Welcome back. Callen-Lorde is a global leader in LGBTQ plus healthcare. Since the days of Stonewall, they've been transforming lives in LGBTQ plus communities through excellent comprehensive care provided free of judgment and regardless of ability to pay. They recently announced that at their Bronx location, they now have same-day appointments available for both new and existing patients from any borough, increasing access to quality and needed health care. Joining me now is the Bronx site director for Callen-Lorde, Yadira Solano. Yadira, thank you so much for joining me.
Thank you.
Now, can you give us a brief overview of Callen-Lorde and its overall mission to serve the LGBTQ plus community?
Absolutely. You know, Callen-Lorde Community Health Center has dedicated decades, of just time, to providing, I would say, sensitive, compassionate, competent healthcare to our queer community. It's really important that our patients, come to that we create a safe space for our patients, that when our patients walk through our doors, that they feel, safe, they feel seen, they feel heard, they feel validated, they feel understood, and most importantly, that they feel welcomed coming to our site.
Now, I would love to expand on that and understand what makes Callen-Lorde a leader in LGBTQ plus affirming healthcare.
You know, as many of you may know, we've been around for a very long time. Just being funded in 1969 in a time where healthcare did not support the queer community. It's been really important for us to really stand out, to really focus on cultural competencies, to really focus on affirming care, just really keep our patients at our forefront and make sure, that we are providing the care that they need.
And I would love to expand on a term. For those who don't know, can you just explain what affirming healthcare means and why it's important?
Yes, affirming healthcare is really important. To me, it's how we see our patient, is how we validate our patient, how we respect our patients. It's really important for our providers to reflect the communities that they serve. Studies show that high you know outcomes in health when our providers really can reflect the communities that they serve. It's also really important, a lot of our providers are of the community. It's really important, particularly in our Bronx site, for me to have providers of color, to have providers that speak Spanish, so that when patients come in, they can, be able to see themselves in their provider.
And I love to hear that because I think that oftentimes people don't think about intersectionality, and they just think, oh, okay, you're a part of this community, so this is what you need. But to kind of focus on languages and culture,
Yes.
added to that care, I think is so amazing. And I love to hear you say that. Now, can you explain how the organization has grown and evolved to meet the needs of the LGBTQ plus community over the years?
Yeah, we're ever changing. We're continuously trying to grow, trying to, change and expand. We've expanded, I would say, a lot in our services, our programs, our locations. Specifically at our Bronx location, we are the smallest site of all three, and currently we occupy a portion of the first floor in our building. And so the goal in 2025 is to expand and completely take over the first floor and the second floor. And this is just a primary example of how we continue to change and evolve to be able to serve and meet the needs of our community.
Now, are there any specific programs or services that cater to transgender and non-binary individuals?
Yes, absolutely. We have, gender affirming care. We have hormone therapy, and a host of support services for our transgender and non-binary patients.
And I would love to kind of expand on just what's available. Can you talk about how the organization educates community about PrEP and other HIV prevention options and just health education overall?
Yeah, PrEP is a big one. It's near and dear to our heart. PrEP is, I think first we could start a little bit just about talking about what PrEP is. PrEP, which stands for pre-exposure prophylaxis, is a medication that is used to help prevent the transmission of HIV. And PrEP can be given to our patients in two different ways. So one is once a day oral pill that's taken. The second way is through a long-acting injection, which is administered every couple of months by your healthcare provider. PrEP is really important to us. We really try to, our patients, our providers, myself, our staff, nursing team, we're always trying to educate patients on what PrEP is, the importance of PrEP, and just really trying to get the word out there. We've been doing a lot of tabling, meeting with community partners and tabling out in the community to really build awareness around PrEP, especially, in the South Bronx and the location where we are, where the HIV rates are really high. It's really important for our patients to understand what PrEP is and for us to try to get as many people as we can on PrEP just to keep everyone safe.
And with that, talking about PrEP and just HIV education, I also want to talk about stigma and what the organization is doing to address that stigma. Because I think when we talk about education, we also have to talk about how the community perceives certain things, and what can we do as a community to kind of stop that stigma. But I'm also curious to know what your organization is doing to address that.
Yeah, we try to stigma, and that's something that we really try to work on and really ensure that we have, diverse staff, inclusive policies. We want to make sure that our patients feel safe coming into our doors. It's really important that when we make sure that we provide care, to all patients regardless of status. So it's really important when our patients come in, that we create a non-judgment, stigma-free environment for them.
Now, your South Bronx location has same-day appointments available. Can you expand on this and why that is so important?
Oh, yeah, of course. It's crucial, I would say, particularly in the South Bronx, right, for us to provide as many resources and as much access to our community as possible. A lot of our patients are dealing with so many different obstacles and so many different issues. Our patients are dealing with food insecurities, with unstable housing, issues with childcare, right? A lot of times, coming to a doctor's appointment at a specific time and date is not really at the top of their priority list, right? When you're worried about if you're going to have a place to sleep the same night, right? So, it's really important, for us to have the same day access appointments for our patients, and just be able to provide that access to the community. Our same day access walk-in appointments are Monday through Friday, the hours of 1 to 4, so our patients can come in. It really gives the patients flexibility to be able to come in at their leisure when they have the time to come in. And so, they can come in throughout those hours to be able to be seen by any of our providers. You can also walk in through those walk-in hours, Monday through Friday, 1 to 4, to access PrEP services as well.
And I definitely want to stress the importance and just how amazing it is to have same day appointments, because I think it also can help with your mental health. I know if you are going through something, you don't want to have to hear that you have to wait like 3 months to see a doctor, especially if it is something that's a little bit more serious. So I think that is groundbreaking, and I love to hear that there's something like that available for people who need it most. So thank you so much for kind of just expressing that and letting people know where they can go about that. Now, how does Callen-Lorde engage in advocacy work to advance LGBTQ plus healthcare on a systemic level?
Well, we do a lot of work. We have an advocacy team dedicated to that work. A lot of that work is done through policy work, through education, and through partnerships. We engage with a lot of elected officials on different levels, and we really push to continue to advocate to elected officials, advocate for our patients, and to really continue to help them understand the importance of the work that we do. When it comes to education, it's really important for us as an organization to really stay abreast of what's going on a state and local level, so that way we can keep our patients informed of what's going on and be able to help them work through all of these changes that are happening. And in terms of advocacy, like I said, we have an advocacy team that's dedicated to that. They go to Albany City Hall all the time to just really advocate on behalf of our organization and really advocate on behalf of our patients, and or just to continue spreading the word of just the importance of the work that we do.
Now, what can the community do to support Callen-Lorde and its overall mission?
You know, I think just really understanding what we do, really understanding just the importance of the work that we do. Our mission, our goal is to really just to again provide non-judgment, care, you know, high level quality care to our patients in our community, and to make sure that all people of our community feel welcomed, feel safe, feel loved, and feel heard, being able to come into our sites.
Now, I'm curious to know what inspires you most about working at Callen-Lorde.
It's really it's being able to wake up, come to work, and know that I can help someone. Know that, specifically I would say at our Bronx location, it feels like a family. We are a small site, but I think we are a small and very mighty site. And, I think one of the things that stands out of our site is that patients come into our site, they know us. We know them by name, they know us by name. We have patients that come into our site just because they want to have a conversation with someone. And that, to me, it really makes me feel proud of what I do. It makes me feel happy that I can make someone else feel happy, and that, that our patients feel really just, we create a place where they can feel special and feel welcomed. Yeah, it really warms my heart and makes me feel happy, and just gracious to know that I'm a part of the mission and what we stand for and what we do.
All right, well, I want to thank you so much for joining us and sharing a little bit more about the community that you've built at Callen-Lorde. With us here in the Bronx is definitely needed, so thank you so much.
Thank you so much for having me.
To learn more, please visit their website at callenlorde.org. We have to take a quick break. We'll be back with more Open right after this.